Swedish Medical Center prepares for possible strike by thousands of nurses and healthcare workers. Swedish Medical Center, preparing for a Tuesday strike of 7,800 registered nurses, nursing assistants and technical and service caregivers, has rescheduled all elective surgeries, patient classes and some other procedures for much of next week. Dates for urgent and emergent cases will stay the same, according to hospital spokeswoman Tiffany Moss. But the postponements illustrate the massive planning underway as Swedish prepares for the possible job action. The workers, represented by Service Employees International Union Healthcare 1199 NW, plan to walk off their jobs at 7 a.m. Tuesday and return at 7:30 a.m. Friday. The hospital and union have not been at the negotiating table since January 14. A strike would affect Swedish campuses in Seattle at Cherry Hill, First Hill and Ballard, as well in Edmonds, Issaquah, Mill Creek, and Redmond. The hospital has promised to keep its doors open during any walkout, and plans to bring in thousands of replacement caregivers from across the country, said Kevin Brooks, COO of Swedish First Hill. Hospital spokespeople declined to give an exact number. "It's an industry standard practice," Brooks said. "There are national agencies that specialize in this work and orchestrate this all the time." The replacement caregivers will work Tuesday to Saturday at the 7 impacted campuses. Other facilities, including those in Bellevue, Everett, Renton, and Shoreline, will not be affected. The hospital is continuing to notify its patients of the changes in schedule, Brooks said. All activity between Tuesday and Sunday morning, excluding critical and emergent cases, will be rescheduled. Normal operations will resume after that. "We have taken every measure to ensure our care is as high quality as it has ever been," he said. "We trust our caregivers and these replacement workers." SEIU members initially planned to walk out January 14, along with healthcare workers from 2 other unions, the Washington State Nurses Association, WSNA, and UFCW 21, but postponed it while the hospital and bargaining teams continued to negotiate. The 3 unions represent a combined total of 13,000 workers in Washington. Swedish is affiliated with Providence Health and Services. Members of WSNA and UFCW 21, which are part of the Providence workforce, have reached tentative agreements with management. According to a recent statement from Swedish CEO Guy Hudson, the most recent package Swedish offered its workers includes an 11.25% wage increase over the next 4 years, a zero-premium preferred provider organization medical plan for full-time caregivers, and their families, who earn under $60,000 annually, no premium or deductible increases for the Swedish PPO medical plan over the life of the contract, and the hiring a new chief diversity officer. For more on this story, visit the news article link.